988 is Louisiana's suicide and crisis lifeline, meant to help those suffering from mental illness. The line has seen a sudden spike this month leading up to the holidays. I sit with Robyn Thomas, the suicide prevention coordinator with the Louisiana Department of Health, and I talk with her about the uptick in callers. 988 is Louisiana's suicide and crisis lifeline, and this time of year it seems like there's more people that are calling. Is that normal?
Well, we are seeing an increase from last year. 988 was launched on July 16th of 2022. Prior to that, we did not have entire state coverage for Louisiana for Lifeline calls. So with 988, we were able to bring in 2 certified Lifeline crisis centers to respond to Lifeline calls for the state of Louisiana. We are seeing that more people are reaching out to the Lifeline, and that's a good thing. That means that more people are becoming aware of the service, that it's available, and then they're connecting to the service. We want to make sure that we're increasing awareness of 988 because that helps to reduce stigma and increase help-seeking behavior for individuals. We want to make sure we're sending the message that it's okay if you're not feeling okay, and if you're not, we want you to reach out. And when you reach out, you'll be met by a trained, competent, compassionate crisis counselor who's trained in crisis intervention and suicide prevention, and they'll work with that caller to try and de-escalate that call on the phone. They'll help collaborate with the caller in ways to make them feel better, provide support to them, and then connect them to local resources in the area.
All right, so that influx in callers doesn't necessarily mean that there is a mental health crisis that's developing right now.
That's absolutely correct. It could mean that people are becoming more aware of a service and they're using the service, and that's exactly what we want to happen.
So I know that it's called the Suicide and Crisis Lifeline, but
Right.
I mean, what are people calling in specifically for?
People call in for various reasons, and one of our crisis centers is a blended 211 center, which is information referral services. A lot of the calls, are anxiety, depression. We want to clarify that it's called 988 Suicide and Crisis Lifeline, but it's for anyone that's experiencing any type of emotional distress. It can be a mental health crisis, a substance use crisis, or any type of emotional or suicide crisis. If you're anxious, feeling stress, just sad, lonely, what we found is that a lot of people just need a listening ear. And when they call 988, a lot of times those calls can be de-escalated on the call without any further resources.
So what are the caller trends? Are we seeing older people call this line? Is it younger people? Who's primarily calling in?
Everyone, we are seeing an increase in youth reaching out to the line. So we have seen an increase in that.
So is it texting as well? Can you text this line?
Well, right now, you can text and chat, and that will be answered at the national backup. Right now, chat and text is not being answered in Louisiana. We're working closely with our crisis centers in Louisiana to prepare their readiness to respond to chat and text. We plan to have a soft launch in December of chat and text. There will be limited access. I believe it'll be from 7 to 1 p.m. until we can really monitor what that demand is going to be. We are seeing an increase in state demand for chat and text. So we are seeing the demand data that's coming in. So we know the demand is there. We're going to work with the crisis centers to make sure that they have enough staff and capacity to respond to that demand.
So usually during the holidays, you hear stories about, mental health flare-ups, domestic violence, all of these things. Are you guys anticipating an increase in caller volume during the holidays?
With the holidays, we really want to make sure that we're being proactive and really promoting the prevention piece of mental health, making sure people are taking care of themselves. We know that stress is a big part, of the holidays. Grieving, people have lost loved ones, financial strains, workloads. So we really want to focus on the suicide or the mental health prevention piece around the holidays. holidays. It is a myth that, suicide rates increase during the holidays. We usually see our peaks in the spring months, April through August. But we do know that people, do struggle with mental health during those times. So we definitely want to make sure that we offer that support, and the Lifeline will be there for them to call. We are working with our crisis centers to increase their capacity to staff up for increases in call volume. So they will be ready to receive those calls.
All right. So is there anything else that anybody should know about this Lifeline?
We really just want to make sure that we're promoting 988 and the Lifeline, and making sure that, we're eliminating that stigma about reaching out, and that, a lot of Americans do struggle with mental health, and that, there is hope. Recovery is possible, but you have to reach out. You have to reach out for help, and we just want to encourage people to do that, and that's what 988 is.
All right. Well, thank you so much. Anyone is welcome to call the 988 Lifeline. A new call center was just added, which means more calls will be answered.